Muy buenas tardes, son las 19 horas con un minuto del martes 12 de mayo de 2020. Estamos en el Palacio Nacional de México, en la Ciudad de
Good
México.
evening.
Estamos por empezar
It is
la conferencia de prensa
7:01
diaria sobre la situación
on the
mundial
12th
y
of May,
nacional de la
2020.
pandemia de COVID,
I'm here at
enfermedad
the Governor
causada por el nuevo
Palace,
coronavirus
the government's palace here in
SARS-CoV-2.
Mexico City, and we're here
Hoy
to
nos
talk
vamos a
about
enfocar a
the
3 temas,
national as
como
well
siempre
as
el informe
global
técnico diario que presentará el doctor
situation
Alomía.
when it
Enseguida el
comes to
informe semanal de movilidad en el
SARS-CoV-2.
espacio público que presentará el doctor
We
Ricardo
will be going
Cortés.
over the
Y hoy
technical
es un día
report
de gran gusto y
as
de
well
gran
as
orgullo porque
the
tenemos aquí
mobility
nada menos que
report in public
a
spaces.
3 jefas.
Dr. Ricardo
Bienvenidas,
Cortes will be
jefas.
presenting.
Y las voy a
Today's a
presentar
great
hoy, que
day,
es su día, hoy como lo
lots of
pusimos esta
pride.
mañana, es el Día Internacional
We have
del
3
personal de enfermería,
amazing women
precisamente
here.
de la enfermera,
Welcome.
y esto atiende a que hoy, hace
Today
200 años, nació
is
Florence
the
Nightingale, que
International
es
Day
conocida o
of
asumida
Nurses.
como la madre de la enfermería
So
contemporánea, la madre moderna,
today,
además de haber sido una
200
brillante
years
enfermera,
after Florence
humanista
Nightingale, who
y muy
was
caritativa,
the
y
mother of
epidemióloga,
the
y fue
profession, the
estadística, con lo cual
modern
a mí también me
contemporary
llena de
mother
gusto
of
y orgullo.
uh,
Pero nos
nursing,
acompañan 3
a
jefas que las voy a
humanist,
presentar en el
a
orden en que
creative
irán
person,
ellas exponiendo.
as well
Es la
as
maestra
a
Norma Patricia
statistician.
Torres López,
So it's
quien es
great
jefa de
to
enfermería de
have
primer nivel
these
de
3
atención
here
en el Instituto
who
Mexicano
will
del Seguro
give
Social.
their
Ella está
presentations
al
with
frente de
Norma
personal muy
Patricia
joven,
Lopez,
59 enfermeras en
when she
distintos
works
rangos de
in
la
the
jerarquía
Mexican
profesional
Social
en
Security
el primer nivel de
Institute.
obtención. Enseguida expondrá la maestra María
She's in
Isabel López
charge
López,
of
quien es jefa de
over
enfermería
1,000
de tercer nivel
different
en unidades médicas de alta
nurses
especialidad
in her
del Instituto
institution.
Mexicano del Seguro Social y quien tiene
And
a
then we
su
have
cargo la
Miss
coordinación
Isabel
de
Lopez Lopez, who's the
20.067
head of
enfermeras. Y
nursing
finalmente, la
in
maestra Sandra
the
Moya Sánchez, jefa
high
de enfermería
specialties
en el segundo nivel de atención,
organization
con
here in
a su
Mexico.
cargo más de
And then we
90,000
have
enfermeras. Como
Miss
pueden ver,
Sandra
son
Moria
jefas.
Sanchez.
Y
She's at the
felicito por lo
second
tanto a
level
ellas
of
y a todas las
medical attention
enfermeras y también enfermeros
here
que
in
forman parte del
Mexico.
Sistema
These
Nacional de Salud.
are
Desde luego,
heads
ahora nos acompaña el del
heads
Seguro
of
Social,
their
pero
nursing
están también
departments.
las demás instituciones,
And
los
so
centros
I'd
de los
like to
servicios estatales de
give
salud,
my greetings to
los
all
hospitales
nurses out
federales
there who are
y
working
también
in
los institutos
health
nacionales de salud,
and who
así
are
como
working
el
in
ISSSTE,
Social Security,
IMSS,
as
SEDENA,
well
CENIT
as
y
in
los
the
institutos
different
de
health
seguridad
departments
social
across all the
de
states
más de
and the National
14
Institute of
federativas.
Health,
Entonces vamos a darle la palabra
Sedena,
al doctor
Semar,
Alomía, si nos conduce por el
and
informe
the
técnico, y nos vamos
Social
de manera
Security
expedita para
Institute,
dar tiempo a la intervención de las
which is
jefas y
over
también
14
preguntas de
different
las maestras.
federal organizations, institutes.
Mucho gusto, señor subsecretario. Muy
So
buenas
we will go
noches
ahead
a todos y
and
todos. Vamos a iniciar en
get
este
through this quickly so we
día
can have time for
51 de
questions.
Jornada Nacional de Sana Distancia y
Thank you,
del
Mr.
SARS-CoV-2,
Secretary, and
que es
good
el
evening
nombre
to
de la conferencia
all.
vespertina en la que
We
nos
are going to
encontramos
start here
esta tarde noche. En la
on the
siguiente diapositiva
51st
veremos el panorama
day,
internacional. Continúa la reducción de la pandemia
the
activa,
74th
28% son los casos confirmados en
afternoon
los últimos
conference
14 días
that we've
en
had.
todo el mundo. Y
And we're going to
podemos ver
start with
además estos
what
cómo
we
se
see at
encuentran
the
distribuidos
international
en las
level.
diferentes regiones de la
There
Organización Mundial de la
are
Salud. 49.6
some
está a la cabeza la
here, as you
región
can
de
see
las
on the
Américas, aunque
screen,
también ha habido una reducción
of all the
muy leve,
regions across
reducción
the world, all the
en los
cases are
últimos
spread.
días. En la siguiente diapositiva actualizaremos
49.6%
nuestras
of
cifras
cases are found
nacionales,
in the
38.324
Americas.
los casos
And then
confirmados. Recordar
this
que estos
has
son los
been
casos
going up, but
acumulados
slowing down
desde el
in
27
its rise
de
in the
febrero
last
que se
few days.
confirmó el primer caso.
We have
Sin embargo, es solo la
38,324
cuarta parte de
confirmed
estos,
cases. These
816, los
are
que iniciaron
across the
con signos y
board
síntomas de enfermedad
since the 28th
en
of
los
February when
últimos
the first
14
case
días.
was confirmed
Son
until today.
3.926 las defunciones que hasta el momento
And
se han
then we
confirmado
have
con pruebas de laboratorio positivas de
8,817
SARS-CoV-2,
confirmed and
pero
active
también
cases
vean
in the
que
last
los que han salido
several
negativos
days.
a la prueba ya son más de
These
80,000,
are
casi
those
81,000
that have been
personas que también
positively
han sido
confirmed
estudiadas de
with
este grupo total
COVID.
de
as well as
personas que han sido estudiadas para la enfermedad.
there's almost
En la
some
siguiente diapositiva vemos la distribución de la carga
8,900,
acumulada en el
and this
territorio
has gone up.
nacional, 29.9 la incidencia.
And we've also had 142,204 who are currently being watched to see if they are, if they are confirmed cases. So this is a massive, we can see across the national, there's the distribution across the country. We saw in the map, but now we see from all the different states, from Mexico City across the whole country. So we can see here the cases across the country that are confirmed active cases, some more than 8,800 cases. In the next slide, from the 817 cases, we can see where those are divided up amongst the different states across the country. Now we have where the cases are, where the most recent transmission has occurred across the country in the various states. So we can see in the different federal entities across the country, the different incidences where we have seen the highest numbers are the darkest, and then the colors that are lighter, there are not as high cases. So here you can see rapidly which states that are having the most active transmission. Later we have the deaths total, and these have been confirmed by different labs. We've had 3,926 deaths, and then 277 that are suspected to have been deaths as a result of this illness. Next, we have by state all of the deaths across the country. You see the light yellow is those deaths that will be confirmed in the coming days if they were actually were deaths caused by COVID-19. So here we can see all the confirmed cases as well as the suspected cases across the timeline since we saw the first cases, and these will be confirmed, the suspected cases, soon in a lab. And here we see 1,997 new confirmed cases, which is a 5.5% increase over what we were seeing yesterday. And we can see here at the very bottom, the orange bar graphs in which this is increasing. We'll see more information about this in the coming slides. Now we have here the different beds that are available across the country. There's 712 hospitals right now available, and 695 that have been notified. There are 15,128 beds that are available and 7,716 that are currently occupied by COVID-19 patients. So here we can see from Mexico City across the country, all the availability of hospital beds at a very general level across the country. And so we can see those beds that are occupied currently and those that are available and becoming available as people are getting better, and the expansion of the beds, the hospital bed space that they are having. And so this is definitely different across the different states according to the need in those different states. And then we have the availability of hospital beds with ventilators. So there's 56% or 51%, depending on the different entities and the different cities. We can see Sinaloa, Mexico City, Quintero. These are places that have had the beds with ventilators and that have the availability to be able to serve those that are affected by this disease. Okay, thank you very much.
Pasar la primera diapositiva del informe de movilidad. Como ya se
Thank you very much, Dr. Lopez-Gatell. We're going to go on with the first slide, and when we're looking at mobility. And we've been showing this for about a week now. Mobility over 3 different systems, and this is through Google, that the data points that Google has to offer across the world. And we also have sources from Facebook as well as Twitter. So I don't want to take too much time here, but because we want to hear from the nurses that are here with us. So you can see an increase in mobility. But other states have kind of maintained the level of mobility that they've had, and there's been 76% decrease in mobility. Next slide. In Coahuila, Colima, Chiapas, and Chihuahua, the mobility has been at a low rate, and with good mobility, and especially in Coahuila, there has been, when we see in Facebook, we're seeing things going down, but in other states, it's kind of maintaining the levels, and we've seen about 56% decrease in mobility. Here in Mexico City has had a 60% drop in mobility, where it's leveled out. And this is through the operation systems of Google as well, Twitter. They've come down more than 50%. And there's really been, we can't really see much of a change. In Durango, we've seen different changes and ups and downs in mobility. But they have had some lower rates of mobility. Next, we have Hidalgo, where mobility is not so much been decreased according to Facebook and Twitter. In Jalisco, mobility has definitely gone down to near 60%. Jalisco has very much responded to what we've called out, and then we have Michoacán, which is around 50%, and we want to encourage the people of Michoacán to continue keeping mobility down. In Morelos, we can see here in the last few days, it has really gone down, mobility, and that's, as we can see on Facebook and a bit on Twitter and Nayarit. Twitter has shown that they have gone down nearly 60%, or more than 60%, Nuevo León around 50%, and Oaxaca in the last few days. From Facebook, we can see a real drop in mobility. Next slide. Puebla, Querétaro, Quintero, they are kind of keeping it flat, have plateaued, maintaining their mobility low at some 65% of mobility lowered according to Twitter. And San Luis Potosí, we can see that there was some light rises in mobility, and this should be definitely something that we at the federal as well as state level should take a look at, and this could really show that we can see 14 days after after movement has begun to be monitored, we can see some increases there. Sinaloa, Sonora, Tabasco, Tamaulipas is keeping it low when it comes to mobility, below 50%, other than Sonora, where things have gone up according to Facebook. It's had a slight increase going back about a week. And we ask the people in Sonora to please stay at home and follow the instruction of the authorities. Tlaxcala has come down according to Google. Veracruz is a bit above 50%. Yucatan is below 50%. That's great. And Zacatecas, as I've mentioned in this press conference previous, has not gotten to our goals of lowering mobility. There has been a decrease according to Google. We appreciate the people in Zacatecas that are asking that people stay in their home. Thank you so much. Thank you, Dr. Ricardo Cortes. And now we turn to the nurses from the public authorities, private, in their social work and through the Red Cross and public health. There are nurses working in academic fields. So today I want to truly say thank you to all of you. So here we have here with us today Ms. Patricia Torres Lopez, our first speaker.
Hola, muy buenas noches a todos y todas. Gracias, doctor López Gatell, por la invitación. Mi nombre es Norma Patricia Torres López, jefe de área de enfermería.
Good evening to all. Thank you, Dr. López Gatell, for inviting us here.
Para mí es un orgullo.
My name is Patricia Torres Lopez, and I work at the first level of nursing in my institution. And there have been thousands that have come to the Institute of Social Security for more than 29 years. I've been working in this. In my work, there are some 19,000 plus nurses who are working in this. And so I'm really proud to be a part of this group of people working together and to be a leader among them. Today, I'm so glad to be here celebrating the International Day of Nurses. The 12th of May was declared the International Day of Nursing. And so today we are celebrating 100 years since this declaration. So in 2000 has been declared the year of nursing, and that's here at the national level as well as the global level. And that is amazing that they have really recognized our profession as nurses. Today is very much relevant with regards to what we are seeing in our country. It's important to mention that everything that we've seen presented here, that we are prepared. We come out ahead, and we have an amazing human resource in our medical personnel. I'd like to mention as well, we are very much sure of the capacity of medical personnel in this country. The personnel that are working, battling daily this illness is not, we're not talking about just those helping those who are sick, but also those who are taking care immunologically themselves. And so this is what I can say about the Mexican Institute of Social Security. And I don't want to set aside or say anything negative about the private side of the health industry, but I believe that this is a very unique point of pride from the public sector. And so those who are working, our colleagues in hospitals and medical centers, are working at a holistic level. They are professionals and they are working from the heart. And that's something that we have to keep at the center of our profession as nurses. It's very important as nurses that the head of the Mexican Social Security Institute has allowed us to participate in the highest levels of the national organization. What can I say? They have recognized us. They have recognized our professionalism as nurses. And this year, this is moving forward, and it's an amazing recognition of our profession. And I'm so proud to know that at this moment, these positions are occupied by my fellow nurses, and they have been recognized at the institutional level for their professionalism. Nothing more do I want to say than to send a warm and big hug to all of my colleagues, and I'm so happy and glad and proud to be a part of this institution. Thank you. Thank you very much for your words. So we now go to Isabel Lopez Lopez, who is the head of the specialty nurses in her institution. Thank you, Dr. Lopez Gatell, for inviting us to be a part of this important forum to talk about COVID-19. I'm Ms. Isabel Lopez Lopez, and I'm here representing the Institute of Social Security. We have hundreds of nurses who are highly specialized working inside this institution. In the institution, we have 185 different sectors in which we work in the hospitals. We are giving direct care through diagnosis or care of COVID-19. We are responding to the health needs among the general public. In INIMS, we have established a form of working within the medical facilities that we have, and we have 192 beds for those who are ill, and nearly 100 for those who need intensive care. On the 8th of May, I was given the honor within my nursing department to work in the hospital Autodromo Rodriguez. I'm working with the administration. We have 235 nurses as well as plus head nurses, as well as 5 director nurses that are taking on COVID-19. And it has been hard work every day, but we have been working alongside with our patients. Those who have their specialization in nursing are doing amazing, difficult work in which they are explicitly carrying out interventions as well as providing care according to the category of need. Viewers, I think it's important to mention to you that in giving quality care to patients, medical staff have to come out of their homes, go to their workplaces, which are places of high risk. And on the pathway, on the way home, what comes to my mind, thinking of the people working in IMSS and at the national level, in IMSS, we thank you so much for your time. Thank you, Isabel Lopez. Now we go to Ms. Sandra for a word from her. Thank you very much. Good evening to all. Today truly is a special day. All nurses across the world, we have waited for this year, 2020, the year of the nurse. We're now visible. We're talking about a profession that hasn't been so visible among the general public. But truly, this moment, we've become more visible than ever. So, my name is Sandra Guadalupe Moya Lopez. I work at the secondary level in integrative nursing. We every day are working, my colleagues and me, to get better results. And we are always looking at you. I have more than 19 years working in the national health system, and it is without a doubt best health system in Latin America. It allows us to grow, to evolve, and get to where we would like to go in our professions. We at the second level, and I say we, I'm just the voice of a team. I'm here as a nurse representing all our nurses, and it's so amazing to be here, part of this such important forum. And they make us truly visible. We can be seen. And I here represent my colleagues who are, I know, working in the trenches, working for the better of all. At the second level, we have more than 90,000 nurses, and it has gone up because of Dr. Reboledo. But we are lacking people, not just on the medical side, but of course in nursing, but in other areas as well. And they have given us the possibility of setting the course for nursing care that reduces risk. As you know, the national public health system in Mexico has truly given Social Security to this country. And it has always been a visionary institution. And many of us we weren't around when it started. IMSS was so visionary. In 1947, they said, we are going to create schools. IMSS has schools all over the Republic, in all states. because it saw that the only way to improve things is to invest. By investing in the personnel, so you would have better medical care. So it's truly a matter of pride for me to say that with that vision, with that human capital, we have 7 schools in Mexico City, in Nuevo León, another one in Baja California, Hermosillo, Guadalajara, Mérida, and Ciudad Obregón.
Terapia intensiva, salud pública, quirúrgica, en donde estamos haciendo la formación de los reemplazos, porque tenemos bien claro que todos nosotros somos de forma temporal. Tenemos que apostarle a crear cuadros de reemplazo.
We have to work on this. We have to improve.
Y por qué no decir, y eso sería lo esperado.
This is what we're hoping for. That these people will be better than us. I am so grateful to be here, to be able to speak with you. Before I go, I don't really want to go. Well, before I go, I want to say to all coordinators in the 35 delegations, thank you so much. Thank you so much for your work. Thank you for your effort, for not desisting, for not stopping, because you're there morning, noon, and night. We've had the opportunity to speak with you, and it doesn't matter if it's a holiday, if it's May 10th, whatever date it is, you're there. And that's the most important thing, because education, which is a collaborative effort, it is thanks to you, because you are the spokespeople so that operational personnel can receive your messages. You are so important. The people who are within these spaces, which are called COVID areas, these people are so important. People are there with heat, with difficult conditions, and they're taking care of patients because that's the essence of what we do. That's the essence of nursing, and that's why we're here. So truly, my dear coordinators, to everyone in every area, I don't want to say any names because I don't want to leave anyone out, and that would not be fair because everyone is doing it. Coordinators, head of nurses, subheads of nurses, specialist nurses, general nurses, all of you. You are the most important part of all of this. And your education platforms that you're working on, or that you're picking up again so that you can work closer with people, these give us the opportunity for our workforce to have fewer risks of getting contaminated. There is so much information. We have so much important information about how to deal with COVID patients. We're seeing how can we avoid lesions on our skin, for example. Please don't be afraid. We are with you, and we are working to continue being exactly what we are. Beautiful country, and us as nurses, we've also sought for social justice because we are committed to Mexico. I send you the warmest hug to Chief Fabiana, working in the institution right now. We talked about that this afternoon. We have mandate priorities. And what we need to do with the Mexican Social Security Institute is underscore discipline. This is what characterizes each and every one of us. A very collegial hug to you, Chief of Nurses Fabiana. We really appreciate this great opportunity. Thank you so much. Thank you, Sandra Moya Sanchez. Yes, we also do send a very warm hello to our dear Chief of Nurse Fabiana. And, well, here we are. We wanted to hear directly from nurses from the Mexican Institute for Social Security. And of course, nurses at ISSSTE, nurses at state institutions, at the Ministry of Health in every corner of our country. If you would like to
nuestras
participate,
bienvenidas,
please,
pero
we
sí
welcome you
queremos que este
here.
día no pasara
Today, we
desapercibido
didn't want
porque
this
estamos muy
day to go
conscientes de la
by without
importancia del personal de
recognizing you and
enfermería
without
y del
recognizing
equipo
the
de salud
importance of
y el
you on
papel
our
crucial que
health
juegan no
teams
solamente en
and
este
the
momento
important,
del
crucial
COVID
role that you
y en
play.
los fenómenos
And it's not just
masivos
about
de
COVID,
salud
it's about
pública,
other
sino en
public,
cada
massive
uno de
public
los
health
días que transcurren
issues that
y que
you help with.
estamos todas y todos al cuidado
And you make
de
sure that we
ellas y
are
de
all
ellos y
taken
en los
care
campos
of
clínicos. Muchas
in
gracias por
the
acompañarnos.
clinical areas. Thank you so much for.
Vamos a abrir a preguntas
Let's
y
open up the
respuestas. Blanca
Q&A
Valadez quedó
period. Blanco
pendiente ayer.
Valadez, I told you
Natalia Vitela,
yesterday, then
ya
you,
no le habíamos dado
Natalia. We
la
hadn't
palabra y
given you
usted
an
a Sergio.
opportunity, and then you.
Sí, sí, luego ahorita nos
Yes,
damos
yes,
cuenta.
yes.
Buenas tardes.
Good
A
afternoon.
todos, felicidades,
Good afternoon.
enfermeras.
Congratulations, nurses.
Preguntarle sobre
I'd
los
like to
acuerdos del
ask you
Consejo de
about the
Salubridad. ¿Me
council
puede
agreements for
informar
health. Could
cómo
you
va a
update
funcionar
me
los
on
semáforos
how the
para
stoplights are going to work
lograr este
in
levantamiento de la
order
sana
to
distancia? ¿Quiénes
achieve
van a
the
aplicar?
Susanna
Si nos
safe
puede comentar
distance
algunos ejemplos.
measures? Could you give
A
us a
partir
couple of
del 1 de junio, tengo
examples?
entendido que van a
Starting
tomar
June
estas
1st, as I
disposiciones.
understand, you're going
También
to
hoy
have
por la
this in
mañana
place.
comentaban sobre las
And
camas
then we were also talking about
disponibles.
availability
Quiero
for
saber
beds.
cuántas
I would
camas
like to know
faltan
how
para
many
tener
beds do we
unidades de
need
terapia intensiva
in the
y el
ICU?
personal que
And
es
what
necesario. Y
workforce,
ya
what
nada más por
personnel is
último,
necessary there as
el
well?
presidente
And
habló de
lastly,
10,000
the president talked about
ventiladores
10,000
que se
ventilators that
adquirieron. Quiero
were
saber cuándo
acquired.
o
When? I'd like to
cómo
know.
o dónde
When?
están,
Where
cómo
are
se van a
they?
colocar,
How are
instalar
they going to be placed?
para
Where?
poder responder a la
So that we
pandemia.
can
Gracias.
answer
Muchas
and
gracias,
address this
Blanca
pandemic.
Valadez, por
Thank you,
sus
Blanca
preguntas.
Valdez, for your
Me voy
questions.
primero a la
First, I'll
última
go to the
y
last
le
question,
pido, si es tan amable, de
and then I
hoy por la
will
mañana
ask
efectivamente quisimos
you
presentar
to repeat the
sus
other
muy buenas
ones.
noticias,
This
la enorme
morning, we
expansión
wanted to
que
talk about the
hemos
massive
logrado del
expansion that we
Sistema
have
Nacional
achieved in
de
our
Salud,
national health
específicamente en
system,
sus
specifically
áreas de
for
atención médica en todas las
users
instituciones
getting
del sector.
medical attention
Esto
in
es
every
motivo de
sector.
gran
This is
satisfacción
so satisfying.
porque nos ha permitido
This has
ver
enabled us
el
to
poder que
see and
tiene
to
el
be able
trabajo
to
colegiado, el trabajo
view the collegial,
multiinstitucional. Históricamente, una de las
multi-institutional work
grandes
that is going on,
limitaciones
which
del
had
Sistema Nacional de
previously been
Salud,
a great
además
limiter
de la
in
falta
our
de
national
inversión
health
y falta
system
de
because of a lack
desarrollo que ha
of
tenido en particular en
investment,
los últimos
and
30 y 15
also
años, ha
because
sido
of
la
over the last
fragmentación,
15 to
que la
30
fragmentación
years, the
es histórica.
fragmentation that has gone. It's
Siempre ha sido
historic.
un reto,
It's always
cada
been a
administración se ha planteado la
challenge.
idea
We've
de
always
integrar, unificar
suggested unifying
las
and integrating
instituciones del
all our
sector y tener un
institutes
sistema
in the
único de
sector
salud. Es
because
una
we do have a
aspiración
unique
que
health
nosotros
system here.
mismos
This
al
is
inicio
something
de
that
este
we
sexenio
aspire to, and that's
planteamos
what we
como
talked about
una
at the beginning
meta
of this
posible.
6-year
Sin embargo,
presidential
como en su
period.
momento lo anunciamos, consideramos
We
que no era
also announced
procedente
that
si no se
if
solventaban
we
otras
don't
enormes
solvent
deficiencias
the
estructurales
massive
que tienen
deficiencies that are structural
o que resultan
and that
en que
lead
la
to
capacidad
us
de
having
cada
a
institución es
reduced
muy diferente
capacity at
entre
some institutions and
cada una de
higher
ellas y
capacity
también en el
at other
territorio nacional.
institutions
Como todo
all
el mundo
throughout
conoce,
Mexico.
en México
As everyone
el
knows,
sistema
in
de
Mexico,
salud,
our health
además de
system,
estar
besides
fragmentado
being
entre
fragmented
instituciones,
among
la
institutions
Secretaría de Salud,
between the
el
health
IMSS, el
ministry,
ISSSTE,
EAMS,
Pemex,
ISSSTE,
y
Pemex,
las partes
and then the
militares
military
de la Secretaría de Defensa y
hospitals,
la
as
Secretaría de
well
Marina.
as the
Además,
Ministry of
está
Defense
fragmentado en
and the
32
Navy.
sistemas estatales de
Those
salud
represent
y además en
32
institutos de seguridad
hospitals.
social
And then we also have
estatales.
these other
Entonces, cuando
state
empezó el
Mexican
sexenio,
state health
teníamos la idea de que era
institutions.
posible
So we
integrarlo,
had the
pero
idea that
pronto nos dimos
perhaps we
cuenta
could
que teníamos
integrate
que
all of
priorizar
that, but then
el
we saw that we were going to
primero
have to
los
prioritize
cintos de
the
la integración,
foundations of
logrando
integration
unificar
before we
la
would be
capacidad
able
de
to
las
build
instituciones.
something foundations.
Porque evidentemente la epidemia de
Clearly, the
COVID,
COVID
más allá de
pandemic,
los enormes
beyond
retos que
just the
implica
incredible
y de la muy
challenges that it
desafortunada y
involves,
siempre lamentable consecuencia
well,
negativa
we
sobre
have
la
that
salud y
negative
la vida
consequence on
de las
health and
personas,
people's
nos está
lives.
mostrando
Besides
la
all of that,
utilidad de
it's showing
trabajar
us how
todas y
useful it
todos
is
de
to
manera
work all of
conjunta.
us together.
Entonces, hoy estamos viendo un
So
sistema
here
de
we're
salud
taking a look at a
que
health
ciertamente de
system
manera
that,
temporal
well, in a
quitó las
temporary
barreras de la
way, broke
derechohabiencia
down
para
those
poder atender
barriers to be able
pacientes
to
no
attend to
aseguradas y no
patients who were
asegurados
not
en
insured
unidades del Seguro
at
Social,
units
cuando menos en la Ciudad de
that were
México, que es donde
private
estamos enfrentando
areas.
la mayor
And this is in
carga
Mexico
de
City, where we
enfermedad
have
por
the
el COVID.
highest burden of
Entonces,
disease for
esta
COVID.
mañana hicimos
So
esta
this morning we made a
La
presentation.
información es muy completa
The
y muy vasta.
information is
Está ya
very
a
complete.
disposición o
It's
debería estar
available, and
en
it
este
should
momento
be
ya
right
en el
now
sitio
available for you on the website
coronavirus.gov.mx, con los específicos,
coronavirus.mx,
personal,
where you can
camas,
see
ventiladores
beds,
y otros
workforce
insumos que han
numbers,
sido
and
adquiridos.
supplies that we've
Y le pido si es
acquired.
tan amable de
And so if you could
revisarlo ahí.
please take a look at those numbers there. 8,000 beds, and that you would still need 4,000 more. And of those, I wanted to know if those beds available, and is our workforce at the level that we need it? Do we have the number of people? I understand your question. Yes, just as our president pointed out today, in order to prepare, we have a number of different mathematical models, some that we had previously created or had been created by the mathematicians, and we've also done predictions team along with the Mexican Social Security Institute to see what are the most challenging scenarios, what is the maximum transmission rate, when will that be, how many would we need to hospitalize? We're thinking around 2,000 people. Then after that, we identified a pattern for even distribution, where at each point in each state, we saw that they would have their own dynamic there in terms of the curve. In specific, Mexico City was very challenging, one of the most challenging. But we saw that the majority of the population would not be hitting that peak at the same time. So we visualized that the challenge was going to be much lesser than what we thought, 60% less than what we had originally predicted. But we are prepared for what we had originally predicted. In terms of the specific challenge of ventilators, this situation that is asynchronic, that has not been in synchronicity, this has enabled us to make decisions, again, that are generous, solidary, where we can redistribute what we called the COVID package. And this is ventilator, monitor, and also a specialized health professional that is required to take care of someone who is in those critical condition. Now, at a certain point, for example, when Guadalajara started to have an intense rate of transmission, or Monterrey, for example, we saw that we would be able to have this package and make it available from Mexico City, because Mexico City would be in the descent of the curve in terms of transmission rates. I want to take advantage to say thank you, David Leon, coordinator of civil protection. You have been instrumental in this effort to coordinate this institutional effort, not just in the health sector, but outside as well. The stoplights. I am still not going to give you too much information on that, because tomorrow morning we are going to be talking about that at the morning conference with the president. But what I can tell you right now, on May 12th, International Day of Nurses, we are reviewing a proposal for a plan for deconfinement or reopening of the economy, where we are going to be calling it the new normality. We're not going to be going back to how we used to act before COVID. We're going to talk about this at the day, on the day, May 30th, when we end the Susana Safe Distance campaign. And we're going to talk about specifically what you need to do and what the strict prevention measures are for health safety. What is the fundamental change here? National measures that were inherent in our safe distance campaign. We're going to talk about how the transmission is spread in different areas in different states. Some people have high transmission rates. Some people have the beginning of the ascent of the transmission rates. These people cannot lessen or relax their measures, their massive mitigation measures. We can't lose focus of the goal in the far distance. So at one moment we will be taking at one point we will be lessening the Susana Safe Distance campaign in some areas that have low transmission rates, or where the transmission rate is going down. But in other places where transmission is speeding up, we're going to have to keep those measures right in place. Do you have any examples? I'll give you some tomorrow. Natalia Vitela, and then Araceli, and luego you, and you. Thank you. Good evening.
Doctor, yo le quiero preguntar,
Doctor,
el presidente
let me please
dijo
ask you,
que
the
si hubiera
president said that
problemas,
if there were going to
rectificarían
be
el
problems,
reinicio de las
that
actividades.
he would
Entonces, quiero
be
saber
talking about
qué
when
tienen
activities would
contemplado, qué
restart.
podría
What could he
suceder
be thinking?
que
What could happen
decidieran
to make him
pues, esta
decide
rectificación.
to
Claro, gracias Natalia. Esta es
put the
una
measures
pregunta muy
back in place?
interesante
Very
que se hace
interesting
todo el
question.
mundo.
Yes, everyone's
Nosotros
asking
para
that now.
llegar a este plan,
For
como siempre,
us,
como en
the
todas las
plan,
fases,
just like in every phase,
revisamos las
is we review
recomendaciones de
the
la Organización Mundial de la
recommendations
Salud,
from the
las de la Organización
WHO
Panamericana de la Salud,
and
las que
the
hacen
Pan
otras
American Health
agencias
Organization, as
internacionales
well
o
as
de
other
país
international
de salud
organizations.
pública, y hay lecciones muy
And we
útiles
take a look at the
en lo que está haciendo
lessons there
Estados
to
Unidos,
see
en lo que
what we
está
can learn
planeando
from the United
Francia,
States, from
Alemania,
France,
Reino
from
Unido.
Germany, from the United
Hay
Kingdom.
comunidades
We see
académicas que
that
han
there are
ya puesto
academic
a
communities
disposición
that
algunas
have made their
recomendaciones técnicas
recommendations
sobre la
available, their
etapa
technical
de
recommendations
desconfinamiento.
for this
Y en todos los
deconfinement
casos lo que se
phase or
ve es un
process.
patrón de
And everything that we've
reconocimiento del
seen is a
riesgo
pattern
potencial
of that
de
people have recognized
un
the
rebrote.
potential
Entonces tenemos que
for
tener
another
conciencia de
outbreak.
ello.
We have
Hoy,
to be
12
very
de
aware of
mayo
this.
de
Today, May
2020,
12th,
Día Internacional de
2020,
las Enfermedades,
International
vuelvo
Day
a
of
decir,
Nurses. I
para que
must
quede
say
constancia
again,
pública
so that
hacia
this
ustedes en la
is
audiencia,
right very
no
clear to all
es
of you.
una
This is not
liberación completa y regresar a la
freeing
normalidad.
everyone out of their
Quiere decir
houses
que
and
de
going back
manera
to normal.
extraordinariamente
In a
cuidadosa
very, very
tenemos
careful
que hacer
way, we are
un
going to
regreso a cierta
slowly go
normalidad
back to a
para poder
certain level
reactivar
of normality
la vida
so that we can
social, la vida
reactivate social
económica,
life,
sobre todo las
economic life,
economías locales,
especially local
y
economies.
quitar ya
And
esta
so that we can take off
importantísima
this
presión que hay
very big
sobre las
pressure that we
economías
have on the
locales, sobre
economy
las
and
personas que
local
viven al día,
economies
los
for people
pequeños
who live day
comercios
to
en
day, small
particular.
businesses
Y
specifically.
esto tiene que ser
And this
cuidado
has to be done
para que
very
no
carefully
regrese
so
de
that we
golpe
don't
una gran
get a
cantidad de
massive
personas al
number
espacio
of people
público,
back
a
in
la movilidad
public,
pública,
back
y aquí estamos también
moving around
acudiendo,
in public.
como siempre, a la valiosísima
This,
ayuda que
we
dan
always say thank you so
expertas y
much to the
expertos
very valuable
científicos en el campo de
information
las
that we get
matemáticas,
from
en el campo de la
mathematicians,
geomática. Mi
from
agradecimiento, como siempre,
scientists.
a
My
CONACYT, a su directora
greatest,
general, la
grateful
doctora
message to
María Elena
you,
Álvarez
Maria
Villa, la doctora
Elena,
Paola Villarreal,
Luis,
que
Paula
coordinan estos
Villarreal,
grupos de reflexión
for
y
being
nos dan
part of
orientaciones muy
these
específicas. Les
work
puedo
groups
adelantar
that are
una, por ejemplo.
studying what we're going to do to
De
get back to
acuerdo
our
a
new
la
normal.
cantidad de personas
According to
que
the number
regresan al
of
espacio
people who go
público
back into
y
public,
a la
and
porcentaje de
according to the
movilidad
percentage of
en el
mobility
espacio
in
público que se
public
recupera,
that we see,
está el tamaño del
that is where
riesgo
we
de
see
un
the
rebrote.
size of the risk of another
Entonces,
outbreak.
esto se tiene que hacer de
So
manera
this,
muy
we really have
organizada,
to do this in
de
an
manera muy
extremely
cuidada.
organized
Hoy
way,
tuvimos
very
con este
carefully.
mismo propósito
Today
por
we
la
had that
mañana
same
y
proposal in the
auspiciado por
morning,
nuestra querida
and
secretaria
our
de Gobernación, la doctora
dear
Sánchez Cordero,
Dr.
una
Sanchez
reunión
Cordero was in
con
a
los
meeting
gobiernos
where she was
estatales,
talking with the
precisamente
state
para
governments
poner a
to talk
disposición de
about them
estas
and
autoridades
say,
sanitarias
health
estatales, que
authorities,
fueron
state health
acompañadas de sus
authority,
secretarias y secretarios de
what are
salud
we going to
y
be
sus
doing to get
secretarias y
this back in?
secretarios de
And they
desarrollo
also had
económico,
people from
cuáles son las
from the
perspectivas de este
Ministry
plan.
of Economic
Y
Development to see
recibimos
how are we going to
retroalimentación
do
muy
this.
valiosa
We got
que
very
después
important
fue
feedback from
incorporada
them,
hacia
and
la
we
presentación que se
incorporated
hizo al
that
Consejo
into
de Salud y de Género.
our
Entonces, ¿qué quiere decir
General
esta idea de,
Council for
en un
Health
momento dado,
Safety.
retomar o
So here we've
recapitular
had
sobre
to
decisiones tomadas?
recapitulate
Lo que
on
quiere decir
decisions
es
that
que
have been made.
el principio de máxima
At the beginning,
precaución
to be
siempre
very, very
aplica.
careful,
Y si
we're
en un
going to
momento
have
dado
to
se
apply
libera
very specific
una
measures.
zona
And if
particular del
there's a
país
specific
o un
area in the
conjunto de
country
municipios
or
o
a
una zona
number of
urbana o un
municipalities
sector
or an urban
económico,
zone or an
vamos a
economic
monitorearlo
sector
todos los días
that is at
con
risk,
múltiples
we're going to be
parámetros
monitoring
que
this
tienen que
every
ver con la
single
curva
day, and we're going to be
epidémica,
seeing how the
tienen que ver
pandemic
con la
curve is
ocupación de
behaving.
las terapias
We're going to
intensivas
see
y la
how many people we
hospitalización,
have in
tienen que ver con el
ICUs.
informe de
We're going to
movilidad en
see
el
how
espacio
this is
público,
reflected in the
entre
mobility
otros,
report,
y esto lo que nos va a
among other
permitir
reports.
es,
And this
de
is
manera
going to
muy
enable
temprana,
us to
si
understand and to see
estuviéramos
ahead of
viendo
time
una
if we
progresión o un
might be
retorno de
progressing
la
toward
epidemia, desde
the
luego,
pandemic hitting
regresar
us with
y
another
contenerla.
outbreak so that we can
Muchas
contain
gracias,
that.
Natalia.
Thank you,
Vamos a
Natalia.
darle la palabra. ¿Quién seguía? Araceli, de Canal 11.
Araceli from Canal 11.
Sí, desde hace tiempo lo que hace.
With this return, are we considering the health of everyone? I know you're going to give us details tomorrow. tomorrow, but in terms of schools, will they be going back to school in a staggered fashion? This filter or going back to schools, will that be done by municipal authorities, like that you had suggested that might be done without general measures being taken, but each state would have different measures? Thank you.
Sin duda, muchas gracias,
Yes, without a
Araceli.
doubt. Thank you,
Efectivamente, esto es muy
Araceli.
importante.
Definitely, that's very important.
Aquí todo mundo tiene que colaborar,
Everyone has to work together
porque todo mundo es
because
partícipe
everyone
del fenómeno.
is
La
a
sociedad en su
participant in this
conjunto
phenomenon.
es partícipe porque lo
Society
vive,
is a
porque también
participatory part of
tiene
this
las
because
consecuencias
they
no
are the ones who are
deseables
going to be
de la
hit with the
restricción de movilidad. Y
non-desirable
vuelvo
consequences of restricting
hacer lo
mobility.
que hemos dicho siempre,
And
un
as we have always
agradecimiento
said,
al
thank you
pueblo de
so much
México,
to
en
Mexicans,
particular a quienes
specifically to the
viven
people
con
who
mayor intensidad o
live
sufren con mayor
or
intensidad las
suffer
consecuencias del
more
confinamiento en sus
seriously the
economías
confinement
diarias,
measures
pero
because
que
they live more day
a
to
pesar de
day.
ello han mantenido una
In
enorme
spite of that,
responsabilidad y
we've
compromiso.
seen
Muchas
such
gracias
great
de
commitment and
mantenerse con poca
responsibility on
movilidad
behalf of
en el espacio
Mexicans
público,
for not going out in
quedándose en
public.
casa. Y
Thank you.
recuerden
Stay
que
home.
nos falta
Please
todavía,
remember,
podríamos decir en términos
we could
generales,
say
la mitad de
generally,
la epidemia.
perhaps half the pandemic
En
is
la Ciudad
still
de
left to
México,
go.
la mitad de la
In
epidemia.
Mexico
En
City, we
Cancún,
still
en
have
Culiacán,
half
en
the
Tijuana,
pandemic. In
más o menos
Cancun,
todavía una
we
tercera
still
parte de
have
la
a
curva
third
epidémica
of the
inicial.
pandemic
Y en
curve
otras
going on.
localidades
And
que
in other
mencionamos
areas, like
ayer
that we
lunes,
mentioned yesterday and
apenas van
Monday,
de ida.
we're just seeing that the
Entonces,
curve is going
todo el mundo tiene que
upward
ser
right now.
partícipe. En
So
cuanto a las
everyone's a
autoridades,
participant.
quien
In
formalmente
terms
es
of
autoridad
authorities,
sanitaria
the
son
health authorities
los gobiernos
are the
estatales,
state
pero desde
governments,
luego la ejecución
but
de ciertas disposiciones administrativas
we also
necesarias para
see
mantener esta
certain
reducción de movilidad
administrative purposes, areas are necessary to restrict
son
mobility, and it's
responsabilidad
a
también
municipal
municipal.
responsibility as
Entonces,
well.
efectivamente,
So
nos
yes, we
interesa
are very
mucho
interested
la
in municipal
participación de las autoridades
participation.
municipales. Nos
We're also
interesa mucho
interested in
la
participation from
participación de las
traditional
autoridades
authorities in
tradicionales,
indigenous rural
particularmente las
zones.
zonas rurales
This morning we had a
indígenas.
very
Esta
important
mañana
question
había una
on the
pregunta muy
risk in
importante
rural
sobre el
areas
riesgo
and
en zonas
indigenous
rurales y
areas,
zonas
which are
indígenas,
areas with
zonas
very low
depauperadas. Y esto es
resources.
muy
And
importante
that
porque
is where we
efectivamente
usually
suele ser
don't have
donde hay
enough
mayor
resources
escasez de
to
recursos de
treat people
atención.
or attend to them.
Entonces, aquí importa
So this
mucho
solidarity,
este
this social
fenómeno de cohesión, de
cohesion
solidaridad
that we have
social
seen in
que se
rural
da en las
communities, that is
comunidades
so
rurales de manera
wonderful.
muy
I
destacada para
really love
protegerse
seeing people
unas a
protecting
otros
each other there. I'm
en ese
also
sentido.
glad
Qué
you
bueno que menciona lo de las
in
escuelas.
terms of the different
De los
components
distintos
for the
componentes
Susanna
de la
Safe
Jornada
Distance
Nacional de Sana
campaign
Distancia y lo que en
and
su
starting
momento,
June
a partir
1st,
del 1 de
this will have
junio,
to be
tendrá
part
que
of
ser parte de
communities
la
in
vida de
terms
las
of local
comunidades
decision-making
y de las
capacity.
decisiones
So we
locales.
have work,
Están los
public
trabajos, el
spaces,
espacio público,
recreation, for example,
generalmente recreativo, y
schools.
las escuelas.
Schools are
Las escuelas son un espacio
very
particular por
particular
muchas
because there's a
razones,
special
en el
risk
sentido
because
del
we
riesgo, porque es
know
conocido
specifically from our
principalmente por la
experiences
experiencia de
with flu
influenza
and other
y otras
respiratory
enfermedades
diseases,
respiratorias, no
not very
tanto de
much
COVID,
COVID because we
donde
don't have
aún no hay
direct evidence,
evidencia
but
directa,
we do
pero es
know
conocido
that
que
schools
los
and
espacios escolares y las
communities
comunidades
that are
escolares,
for basic
particularmente las de
education,
la educación básica,
these are really
son
places
elementos o
that they
espacios
really could
que
be
son propagadores de
propagation
infecciones
areas,
transmitidas por vía
areas of
respiratoria,
high
también otras,
propagation
las que se transmiten por
for
agua y
direct
alimentos
contact.
o por contacto directo.
But
Pero en
one
este
thing that
caso,
we want to
un
do
elemento a
to
prevenir
prevent,
importantísimo
we
es
want to
que
know that
la niñez no
children
contagie
are
a la
not
adultez mayor.
acting
Los
as
niños o niñas
contagion
no contagien a
agents
los
to
abuelos y a las
older
abuelas
people
y
or
otros
to
familiares
adults or to the
adultos
elderly.
mayores.
So in this way, we have to be
Y en ese
even
sentido tiene
more
que ser aún más
careful about their
cuidadoso el
environment.
retorno.
And
También, sin
I don't want
anticiparles
to
demasiado
get
de lo
ahead
que
of
va a ser
myself
la
because of the
presentación
presentation
mañana,
tomorrow,
les puedo
but we
decir que una
do have
consideración
special
especial
consideration.
es que
Only in those
solamente en
areas of the
aquellas
country where we
regiones
can
del país
prove
donde
that there is a
podemos
low
constatar
transmission rate
la baja
and low
transmisión y el
risk,
bajo riesgo y la baja
those are the areas
vulnerabilidad,
where we might open
podamos
schools.
abrir el
Where it
espacio
is
escolar.
not possible to
Donde
keep
no es
schools
posible
closed,
mantener
we
cerrado el
don't
espacio
have
escolar,
a
no hay una fecha a
predefined date,
priori
not
predefinida
in order to
ni para
open
abrir
or not open
ni para no
schools.
abrir las
We are
escuelas,
going to
sino que
monitor
esto va a ser
that and
sujeto a un
decide. And we will be
monitoreo
publicly
que
presenting on
presentaremos
that every
públicamente
week.
cada
And
semana,
we will be doing
pero
that every
todos
day.
los días. Muchas
You
gracias.
and Carlos.
Usted, por favor. Y luego Carlos.
Oh, good. Good evening to
Gracias.
everyone. Liz
Gracias. Buenas
Alvarez
noches a
from
todas y a todos. Liz
Portero El
Álvarez,
Cantón.
reportera del diario Basta
I'd
del
like
Grupo
to
Cantón.
focus
Hoy me
on
quiero
the
enfocar pues a las
protagonists of all
protagonistas,
this,
como
like
bien
you
lo
said,
decía,
Maria and Sandra.
Norma,
I'd
María
like
y
to know
Sandra.
how
Quisiera
are you
saber de qué manera
training
están
the
capacitando
personnel
al
who
nuevo
are
personal
entering
que
into
está entrando
hospital areas. Because yet saw that someone was saying, a nurse yesterday, she was saying she wasn't receiving enough training in how to deal with COVID patients. And please tell me, how are you taking care care of yourself for when you get home? Or how are you cleaning up from after your shifts around your children if some of you have children? I'd love to hear from you. Well, in terms of training, the Mexico Social Security Institute, we all have to be training constantly. We're training our workforce all the time. The most important thing we have are our human resources. And about COVID, the truth is that COVID in our institute, we have strong leaders. We have all started working collaboratively so that we can set guidelines for how to retrofit and how to answer COVID. Within this same program, within that planning that was done, we had a whole subject area about how we were going to be working, how we were going to work with our people, because it was clear to us. Of course, we learn from our neighbors, where we can observe that the majority of people who are getting COVID are workers, are healthcare professionals, because of a lack of protocol. That's why I did mention there is a link, there's a website. You can download it on your phone. You don't even have to go onto the internet every time. You can download this, and our personnel, our healthcare professionals can do the same thing. We also have action cards so that we can go through this change, so that we can do this training. And it's very important to tell people exactly how to put on their personal protective equipment and exactly how to take it off. And Zoe Rebledo was talking about that. He's a visionary. He said, we're going to have more people, not just so that we have a document with people's signature on it to say that they took a course, but that they have also been observing, because that's the best way. And that's a practice, that's something that we weren't doing. We really have to be aware. This is a pandemic. This is a virus that we didn't have information on before. And we're trying to tackle this in the best way possible. There is a lot of collaborative work that is going on. So that's what I was talking about when we started to observe that people began to have injuries because of how the personal protective equipment was on their faces. And so we made a very clear infographic about how we can avoid those injuries that we see on our healthcare professionals' faces. So right now I can tell you we're on the cutting edge, and we have scientific foundations that are right behind us. We are a team of people who are very collegial, and we have many nurses participating, and we're also participating with other institutions. And this is not just teams. We are a country. We are a country that is answering and talking to our personnel and saying, truthfully, congratulations to every single nurse. And thank you so much, because you have been taking the proper protocols and you have been doing this. Wow, you have incredible discipline, but we want you to be doing this with the least risk. We always want you to be working with the least amount of risk. But for us, of course, we always say how you think, how you speak, and how you act. These are protocols that we are telling everyone in the public, and also our personnel. We have to be doing that, or else we wouldn't be congruent. We have our specific measures when we arrive at home, of course. But please, there is no greater combination for failure than ignorance. We cannot be ignorant to what is happening to us. We have to document this. But it really has to be scientific information, and we can't be contaminating our community. This is part of the work that we are doing. Thank you so much. We're out of time. It's 7:59. We're going to end here today, and we'll continue tomorrow. Thank you.
Muchas gracias. Gracias.
I know, sweetie, but sometimes you just have to wait for 1 second.